Hi class, this is Dr. T with a brief message to you encouraging you to post your response to your PICO and identify your project early in the week. I've posted a date for Friday for you to try to get it in. The reason for this is for you to get your PICO question identified, identify your clinical situation so that I can respond to you and give you guidance if you so need it. Be careful that you're looking at a situation that is amenable to nursing interventions that would lead to improved patient outcomes. If you're choosing not to focus on a clinical issue of concern, then you must make sure that you are focusing on a concern that is amenable, again, to evidence-based interventions. It cannot be simply a change in policy or procedure or staffing pattern that you're doing. It has to be something that is an evidence-based intervention that is demonstrated in the research literature to lead to the improved outcomes that you are asserting will occur. Keep in mind that the outcomes you are saying will occur are demonstrated in the research literature. You are not doing research, you are using research. So you are looking in the literature to find the evidence to support the change in practice that you wish to implement. Make sure you make that distinction. You are not doing a research study. You are not going to compare groups and see if things are better or worse after your intervention. When you put an evidence-based intervention into place, you do look at the before and after, but it's the before and after on that unit. You are not doing a research study at all. Remember, you are using research, not doing research. So think about your problem. Make sure it's nursing focused in that it requires nursing interventions, that it's leading to improved patient outcomes or other improved outcomes that will impact patient care and quality and safety. Be sure you have a strong body of evidence to support your change that you are proposing. A note, clinical guidelines are already established as having a strong body of evidence to support a change. So, for example, if you were utilizing a clinical guideline, like, for example, the RNA clinical guideline for supporting breastfeeding, then you would have a strong body of evidence because it's already been established. So when you find clinical guidelines, best practices, and bundles, those are really the best choice for you because you have a strong body of evidence already established. I hope that makes sense to you. If you are choosing to make a change, for example, in nursing education and your population is students, then you would have to be sure that you have the evidence from research to demonstrate an improvement in the student outcomes that you are saying is going to occur. So, for example, if your program does not have simulation and you are proposing to put simulation into place, then you would have to find the body of evidence that supports simulation improves critical thinking in students, clinical decision making, and subsequently can improve patient care, patient quality and safety, and patient outcomes. So you have to make the connection to what those improvements in the students, how that will lead to improved patient care. I hope this is a help to you. Please call or Skype me if you want to talk about your concerns. I will respond to you in the thread where you're supposed to post your PICO. Be sure you follow the directions. Complete it as best as you can with the most detail you can. This is the heart of your proposal. The quality and depth that you craft for this will determine the quality of your entire proposal. This is really the hardest step and the most important step. So it is very important that you get the depth that you need and that the choice that you make is a good one. I'll let you know, so please post as soon as you can. Take care.